These are some of your different forms of enteral administration. So you have solutions, you have capsules, you have tablets, sustained release capsules and tablets, and then suppositories. Each of these kind of has some of their own. Again, they're all administered via the enteral administration. You start to look at page 23 in your textbook. It will explain some of the different variations that these are all considered. Again, they all have administration via the enteral route. Okay, so the enteral route involves everything going through the digestive system. The parenteral route is everything outside of the digestive system. So we look at a lot of your injection-based medications being your parenteral drugs. And we have some examples up here. You have intramuscular, subcutaneous, intravenous, and intraarticular. So these look at all different types of non-oral routes or not going through the digestive tract. So usually these involve some type of injection directly into an area. For instance, an intramuscular injection is an injection into the muscles. A subcutaneous injection is an injection into the subcutaneous layer of the skin. Primarily, when you look at a lot of these, you look at, again, primarily systemic effects. They're obviously with some of the different types of injections, there's drawbacks to them, obviously. For instance, the intramuscular injection could cause a lot of local irritation and soreness at the site of the injection. That's not uncommon to have. Again, refer to the discussion on the parenteral drugs in your textbook for a slightly further in-depth explanation into this, but for the most part, they're pretty self-explanatory. Your intranasal oral inhalation. So these are different types of medications administered in the forms of gases or aerosols. And they could typically be administered through the nose. You see this very commonly with a lot of allergy medications. Or with the mouth, a lot of your asthma medications are typically absorbed this way. The particular drugs that get to the lungs, like for instance your asthma medications, tend to get absorbed very rapidly because of the fact the lungs obviously have a very good blood supply. So the medication gets absorbed pretty rapidly. And a lot of times most of these medications are used to deal with different respiratory pulmonary conditions. They usually involve some type of special inhalation device that will basically propel or push the medication into the body. Some of your more common ones involve, like for instance, your albuterol, which again is your rescue inhaler, and some of your different inhaled steroids that people either take for allergies or asthma will be included in this. Topical medications are basically administered usually to the skin or the mucous membranes. So a lot of your superficially absorbed medications, these are anything that can involve, again, the eyes, the ears, and again, most commonly the skin. They're usually administered via ointments or transdermal patches or different types of creams and powders are all of your different types of topical medications. These medications will be lipid soluble because they can be absorbed through the skin more readily than water soluble drugs can be. When you look at the effects of these, they're primarily all local effects. Usually when you're looking at topical medications, you're looking for it to directly affect that area. For instance, if you're applying a topical medication, say, to some type of skin infection, okay, a skin rash, a bacterial infection, fungal infection, what have you, that's to promote a local effect. There is a chance that if the medication does get absorbed through the skin and mucous membranes, it can cause systemic effects, but the main purpose of these drugs is usually not to cause a systemic effect. Usually it is to have more of a local effect in an area. Again, a couple different examples. You have your transdermal patches, which will basically be a more controlled release type of situation where it allows the drug. And sometimes transdermal patches can be used for systemic effects as well. An example of a transdermal agent which will have more systemic effects are like your nicotine patches or the estrogen patches that are utilized for birth control. Obviously, an example of a transdermal application with a transdermal patch for local effects that we commonly use a lot as athletic trainers is your ionophoresis. And then again, you have your other ointments and things like that'll get utilized as far as being able to apply to different regions of the body. Looking at drug effectiveness, and again, this kind of relates back to how drugs get absorbed. First of all, when we look at exercise can actually decrease the effect of a lot of your drugs. And the thing to think about here is what happens with exercise that could decrease the absorption of drugs. And this is a question that I'll have you answer in the learning module. And just a little hint, it has to do with blood flow. So I want you to think about that as you're thinking about answering that question. Your IV injection, inhalation, and sublingual will all get absorbed the fastest and will have the fastest onset of action. We discussed that a little bit earlier. The orally ingested, again, may take up to 30 minutes. Typically, it's a little closer to an hour. Again, sometimes it just depends on what type of oral administration. The key is with orally ingested drugs is to make sure to take with a full glass of water. That will help break down the medication and also allow it to be absorbed a lot easier. Bioavailability, we look at the amount of the drug that's actually active in the body tissues producing an effect. Again, a lot of what's going to affect bioavailability is how much of an ingested drug will actually be active in the bloodstream. Because again, you have to consider the fact, for example, with your oral, your enteral drugs that get administered orally, remember that they have to go through a first pass effect in the liver. So, for instance, if a drug is 500 milligrams and only 50% bioavailable, that means only 250 milligrams will actually reach the bloodstream. So it's important to understand as far as bioavailability, we look at what's actually going to be active in producing a therapeutic effect. So it may only be a portion of the actual dosage. It may not be the whole dosage of the drug that actually gets utilized. So drug distribution is going to look at how the drug is basically distributed throughout the body. The circulation is going to be what's responsible for taking it to the different target sites. We look at the drug molecules basically being able to penetrate cell membranes. And there's going to be a couple different factors that kind of dictate how those drugs get distributed as they go throughout the body. It's going to be based on ionization, solubility, the size of the molecules, and also the rate of blood flow. Obviously, again, another important, when you look at our typical patient population that athletic trainers deal with, you have to look at the effect of exercise. So obviously with exercise, the cardiac output is going to increase. That may possibly increase the speed at which the drugs are carried to the target site. Now, don't confuse that with absorption. Okay, absorption has a little different thing going on there as far as how exercise affects it. Once the drug is absorbed, exercise will potentially affect that differently because of the fact that the actual circulation is then increased. Another thing that could affect the distribution of the drugs of exercise is that during exercise, hormones get secreted, and that may affect either the actions of the drugs or how individual drugs get eliminated.